Medicare. Medicare is a health insurance program administered by the U.S. federal government since 1966. Medicare is funded by payroll tax, premiums and surtaxes from beneficiaries, and general revenue. It provides health insurance for Americans aged 65 and older who have worked 40 quarters or 10 years and paid into the system through the payroll tax. It also provides health insurance to people with disability status, as well as people with end-stage renal disease, also known as ESRD. On average, Medicare covers about half of the healthcare charges for those enrolled. The enrollees must then cover their remaining costs, either with supplemental insurance, separate insurance, or out-of-pocket. Click Next to view a short video that explains the process for enrolling in Medicare for eligible individuals over 65 years of age.
Hi, welcome to Turning 65, your guide to Medicare. This video will explain how Medicare can work for you as you turn 65. You'll learn what it covers and how to make informed decisions when choosing a health insurance plan. And Blue Cross
Medicare is broken down into 4 parts. Part A is for hospital inpatient coverage. Part B is for medical outpatient coverage. Part C is Medicare Supplemental Medigap and Medicare Managed Care. And Part D is for prescription drug coverage. Over the next several slides, we will break down what that means for each section. Medicare Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Medicare Part B covers certain doctor's services, outpatient care, medical supplies, and preventive services. Medicare pays 80% of coverable services, and the patient is responsible for the remaining 20%. Medicare Part C, Medicare Supplemental, Medigap. A Medicare Supplemental or Medigap policy, sold by private companies, can help pay some of the healthcare costs that original Medicare does not cover, such as co-payments, co-insurance, and deductibles. Some Medigap policies also offer coverage for services that original Medicare doesn't cover. A Medigap policy is different from a Medicare Advantage plan. Those plans are ways to get Medicare benefits, while a Medigap policy only supplements the patient's original Medicare benefits. Medicare Part C, Medicare Advantage, Medicare Managed Care. Medicare Advantage plans and Medicare Managed Care are sometimes referred to as Medicare Part C. They are Medicare-approved private health insurance plans, for example, Aetna, Blue Cross Blue Shield, Emblem Health, United Healthcare, etc., for individuals enrolled in original Medicare, Part A and Part B. When someone joins a Medicare Advantage plan, they are still in the Medicare program and must continue paying their Part B premium. These plans often have networks, which means patients may have to see certain doctors and go to certain hospitals in the plan's network to get care. Each Medicare Advantage plan can charge different out-of-pocket costs and have different rules for how patients get services, like whether a referral is needed to see a specialist or if they can use only doctors, facilities, or suppliers within the network. Medicare Part D is for prescription drug coverage. Let's take a look at a breakdown of each part of Medicare. The 3 reasons a person can qualify for Medicare are age, disability, and having end-stage renal disease. Click each of the reasons below for more information on each. Match the parts of Medicare with their descriptions. Click the X in the upper right-hand corner to close this e-learning and continue on to the next module.